Assalamu alaikum. Let's dive into twin pregnancy, one of the high-yield topic of obstetrics, taken from the USML inner circle. Okay, start with my intro where you will see a patient. Can you diagnose this patient? Look at the back of this patient. He has fever, night sweat, weight loss for prolonged period. Can you tell me the diagnosis? Okay, if you put it in the comment box. Now, twin pregnancy. It is monochromic, monochorionic, monoamniotic. It is one placenta and one amniotic fluid. Monochorionic, monoamniotic, one placenta, one amniotic fluid. Monochorion means one placenta and diamniotic, two amniotic sac. So monochorionic, monoamniotic, one placenta, one amniotic sac. Monochorionic, diamniotic, one placenta, two amniotic sac. There is T sign, T sign at intertwined membrane, T sign at intertwined membrane. In monochorionic, in MD, there is T sign, and if DD, lambda sign. So MD, T sign, and DD, like dichorionic, diamniotic, two placenta, two amniotic side, there is lambda sign at intertwined membrane. First, see this. This is the twin sign, MD, monochorionic, but diamniotic. One placenta, but two amniotic cavity, two amnion. In here, two placenta. In here, two placenta and two amniotic cavity. This is T sign. This is T sign. This is T sign. And this is the lambda sign. Two placenta. There is single placenta. There is single placenta. But in here, there is two placenta. Okay. What are the maternal complication? What are the maternal complication of this? Hyperemesis gravidarum, preeclampsia, hyperemesis gravidarum, preeclampsia, GDM, and iron deficiency anemia. Hyperemesis gravidarum, preeclampsia, GDM, and iron deficiency anemia. And what are the fetal complication? There may be congenital anomaly. Look, fetal growth restriction, very high yield thing, very high yield topic. Fetal growth restriction, that means weight is less than 10 percentile. Okay, fetal growth restriction and preterm delivery can happen, and malpresentation like breech. And in monochorionic twins, there is twin transfusion syndrome, twin transfusion syndrome. And in monochorion, that means monochorion, single placenta, and monoamnion, that means one amniotic cavity, double C, conjoined twin and cord entanglement, conjoined twin and cord entanglement. The risk of preterm labor during a multiple gestation pregnancy is maybe reduced or adequate early weight gain. So this is ultrasonography. So monochorionic, monoamniotic twins are typically managed inpatient. Monochorionic, monoamniotic, typically managed inpatient, beginning at 28 weeks of gestation, and frequent fetal monitoring, non-stress test, and antenatal corticosteroid administration. And double M, patient is delivered at 32 to 34 weeks of gestation via cesarean. So double M and C, cesarean section. Double M should be C. So MD, that is T, that means monochorionic diamniotic is T sign, dichorionic diamniotic is lambda sign, and monochorionic monoamniotic is cesarean section C, corticosteroid corticosteroid, and another C like stress. This should be done. Okay, now, okay, if you look at this picture, looks like there is twin gestation. This one is bigger, this one is smaller. Looks like, if you don't read the question, look at these ultrasound, these uterus scan. Looks like twin pregnancy, so it is twin gestation. And this looks like the lambda sign, double D for lambda sign, dichorionic diamniotic twin gestation with twin peak, twin peak or lambda sign, twin peak or lambda sign. Okay, and now look at the T sign, one placenta, two amniotic sac. This is T sign, one placenta, two amniotic sac. This is an embryonic embryonic gestation or blighted ovum or pregnancy failure, very high yield. An embryonic gestation, blighted ovum or pregnancy failure. An embryonic gestation, a pregnancy with no embryonic development, can present with vaginal spotting. Ultrasound shows an empty gestational sac more than 25 millimeter with no embryo or the sac. So it is twin pregnancy. Okay, if we see another question like here, if we see this question, this 31-year-old woman, there is monochorionic double M, monochorionic monoamniotic twin pregnancy double M. Double M for C, monochorionic monoamniotic for cesarean. The contraction begins and painful 29 weeks occurring 3 to 4 times. There is no leakage of the fluid, and the external fetal monitoring category 1 tracing for both fetus tachodynamometer shows and contraction every 3 minutes. Blood pressure slightly higher blood pressure, and there is cervix is 5 centimeter dilated. There is mucus like vaginal discharge that is lightly blood tinged. Ultrasound shows the presentation of twin in the vertex. Presentation of twin in the vertex and occiput anterior position. The second twin has a vertex position. One is occiput anterior position. The second is vertex position. The placenta is located at the fundus. Urine dipstick show 1 plus protein, so hypertension. A cesarean for MMC, a cesarean delivery, 29 weeks. Which of the indication of these? Which of the following is the indication of the cesarean delivery in this patient? MMC, monoamniotic, monoamniotic twin cord entanglement. This is the cause. Monoamniotic twin cord entanglement. Single amniotic sac but cord entanglement, single shared placenta. So this patient, 29 weeks of gestation, is spontaneous labor with monochorionic monoamniotic twin due to risk of cord entanglement and fetal demise during labor. Emergent delivery is indicated. This patient should be emergent delivery is indicated. And in monochorionic one shared placenta are at risk of twin transfusion syndrome. That means one twin is getting bigger and donor twin is getting smaller. Twin transfusion syndrome, because of the blood supply of to donor can be shunted to another recipient via AV anastomosis, resulting in heart failure and possible fetal demise between twins. And monoamniotic twins, one shared amniotic sac, are at risk of umbilical cord entanglement. So monochorionic monoamniotic umbilical cord entanglement. So MMC, again the C cord entanglement. So CS should be down. because of the risk of the fetal demise leading to hypoxia and fetal demise. Cord engulfment is spontaneous and unpredictable. Liver increases the uh, and the liver increases the risk due to constant agitation from the uterine contraction. So this is all about twin pregnancy. Hope you enjoyed, and sit again, look at the back of this patient and tell me the diagnosis.